So I think what we should do up front here is our translators, before we put them into the translation channels. Danielle, if you want to take it away and explain how folks can take advantage of the translation this evening.
Sure. Thank you, Ron, and welcome everybody. This is Danielle from Rosetta Languages here. We're going to just introduce the language channels for the non-English speakers. English speakers, y'all can sit tight for just a minute or two. I'll start with Arabic. Assalamu alaikum wa rahmatullahi wa barakatuh. Ahlan wa sahlan bikum ila hadha al-ijtima'. اليوم هيكون عندنا الترجمة باللغة العربية. بعد أن ننهي من هذه المقدمة ستجد على الشاشة زرار الترجمة. يمكنكم الدخول على قناة اللغة العربية. إذا كنت تتصل من على هاتف محمول اذهب إلى 3 نقط More Options، اختار اللغة العربية Arabic وبعد ذلك Done، وسيكون بإمكانك الاستماع إلى اللغة العربية في قناة زوم. شكرا جزيلا. إذا كان عندكم أي أسئلة اكتب في صندوق الدردشة. Go ahead, Anna.
Great, hi， 大家好，我係 Anna， 我係你哋今晚嘅廣東話，聽唔聽到啊？我再講一次。大家好，我係Hi, I'm Anna. I'm your Cantonese interpreter for the evening. Tonight, I'm gonna give a Cantonese introduction. 大家好，我係 Anna， 我係你今晚嘅同步廣東話翻譯員。咁如果你需要係同步廣東話翻譯嘅時候咧，你應該會見到下面你個熒光幕嗰度咧有個地球儀嘅喎，咁你就要揀 Cantonese。咁一撳落去嘅時候咧，我就可以為你有呢個廣東話同步翻譯嘅啦。多謝晒。I'm gonna pass it on to Terry. Okay, Terry. Go
Thank
ahead.
you, Anna. Hi, my name is Terry Ying. I'm going to be your Mandarin interpreter. I will introduce myself in Mandarin. 大家好，我的名字叫 Terry， 我是你的国语翻译哈。当这个活动开始以后，你就可以看到这个屏幕下方有这个地球的按钮，然后你点一下这个地球的按钮，就可以看到有这个国语的字样，然后你就可以选择中文，好，就可以听到我的翻译了。谢谢。I'm going to pass it to Nikita.
Hi, my name is Nikita Lamo. I'm going to be your Haitian Creole interpreter. So I'm going to explain in Haitian Creole how to proceed. Bonsoir, nom c'est Nikita Lamo. N'a pas interprété à soi pour vous. So n'a pas dit où le ouais un bouton, un boule qui marque globe blanc, ou pour peser li, ou pour côté qui marque mort. So wap peser mort là, la fini li ka marque soit French ou bien Haitian Creole, wap clic li, wap peser sur li, la fini wap marque done. So laisse ça, wap attendre interprétation qu'a fait. Merci.
Thank you. And thank you to all our interpreters. I'm going to go ahead and start language interpretation for those. So go ahead and do that. And you guys should be in your channels. And for those that are watching this either by looking at YouTube or by MATV after the fact, if you do have questions, you can ask them by emailing info@cityofmalden.org. And actually just one moment, because it looks like there may be an issue with our interpretation channel. Hold on. I'm going to try this one more time. Sorry, if everybody could just bear with me for a second. I just want to make sure we get this correct. And we are almost there. We got it. All right, great. Thank you. So again, for those that are on the panel, we just like to remind everyone that because we are interpreting, if you could just slow your pace down in your responses, that would be helpful. And those that are looking at this webinar after the fact, either by Malden Access Television, formerly Malden Access Television, now UMA, or if you are on our YouTube channel and you wish to ask a question and you couldn't attend live, you can ask those questions by info at cityofmalden.org. And feel free to send us a question in your native language and we will respond in kind. Okay, with that, I would like to now remind everyone, for those that are in the webinar and do want to ask your questions, you're going to do so by making use of the Q&A feature at the bottom of your screen. So if you could ask your questions there, we'll be hunting for them. And the mayor will be taking those questions and going from there. So I'm going to kick it off to you, Mayor Christenson. Go right ahead.
All right, good evening, everyone. Again, I'm Gary Christenson, Mayor of the City of Malden, and I want to welcome you here tonight and say thank you for participating. As always, I want to thank our panelists, Christian Lanphere from Cambridge Health Alliance, Chris Webb, our Health Director, and Kourtney Nickerson, the Chairperson of our Board of Health. As always, we also want to say thank you to UMA, formerly known as MATV, for serving alongside us throughout the past year. And then new to tonight, I really want to say thank you to Danielle and Rosetta Languages. I could see why I provided a testimonial based on their introduction tonight. So hats off to them all. Shukran, merci, sheshia, and doce. I think I covered them all. So with that being said, what we wanted to do this evening was have a different type of forum. As you all know, we have been doing our regular sort of bi-weekly updates on UMA. And in addition, we've also been doing short video updates by our health director, Chris Webb. But tonight, we really wanted to have something dedicated to something around the vaccine. We know there's been a lot of questions about it, not only from you, but from us. And so we thought by coming together, it would be helpful to figure out how we move forward together. So again, welcome. Thank you for your patience. And most importantly, let's get to your questions.
Okay, again, we do want to remind folks that those questions can be asked in the Q&A feature. We don't see any questions that have come in immediately, so I think we're going to go ahead and ask some of the questions that were asked of us ahead of time until we get folks that are asking us in the channel here. Okay.
Before we do, Mr. Cochran, I do want to also acknowledge your efforts. You have been with us from the inception, so it goes without saying, I appreciate your support as well. And just to let people watching know that we plan on Monday announcing Malden clinics, which our residents will be able to sign up for, which Director Webb will go into the logistics and who exactly can participate. And we will also have a call center announced tonight that will run parallel to the clinics that will be announced on Monday. So I do want to thank Mr. Webb and his staff, along with Dr. Nickerson, for working diligently behind the scenes to do all that we can with the limited vaccine that we have. So back to you, Mr. Cochran. I see a question has come in.
Certainly, and actually, before we ask that, the first question, it's sort of not a COVID question, but it's a good one. Kit asks whether or not there'd be Spanish and Portuguese interpretations available. Unfortunately, a lot of times we do these things and interpreters are folks that have to come on and join us. They're people that that need to attend the meeting, and we could not get one interpreter for those for tonight, but we will be getting those after the fact. So what we're going to do is take the result of this video, send it off for translation. So the rewatch of this will be translated in those languages. We just don't have the live interpretation at this moment, but thanks. That's a great question.
All right, first up.
Okay, our first question. Oh, go ahead. I'm sorry. Take it.
When and where will be vaccine sites located in Malden? Also, what type of vaccine, Pfizer or Moderna, will be used? Mr. Webb?
I was going to say, pick me. Okay, I'm excited to announce that we will be having a clinic on February 17th, which is a Wednesday, from 9 a.m. to 5 p.m. We will have 828 appointments for that clinic. We'll also have one on February 20th, which is a Saturday, from 9 to 5. And also have 828 doses for that clinic. The call center, which is the tandem item for this, is an important feature that I think will help the community a great deal. If you go on to the state website and you enter into the Malden vaccination clinic and you're having any difficulties at all, please call 781-661-8500. And the person answering that phone will either be able to answer your questions or register you. So we're going to make this easy for you as we can. Just be patient and we will get to you. If you get pushed to voicemail, know that we will call you back.
Okay, Mr. Webb, where will these clinics be held?
More excitingly, at the Salem Woods School Fieldhouse. We're going to have 12 vaccinators set up, so it will be a large clinic. But you'll be in that huge gym. There's elevator access, and there'll be plenty of ventilation and plenty of space. So we're confident it's going to be a very, as usual, a very well-run clinic. You'll go in, check in, go to get your vaccination, check out, and go home.
All right, Mr. Webb, who will be vaccinated?
The best part of that is we have on the 17th, which is the Wednesday, we're allowed to allow phase 1 that hasn't been vaccinated yet, any public safety personnel that have not been vaccinated yet, and those persons 75 or older.
Okay. And maybe this is for you and Mr. Lanphere. What type of vaccine, Pfizer or Moderna?
We're going to be using Pfizer at these clinics. We no longer have a resource for Moderna.
Okay, Mr. Lanphere, do you want to add to that?
Yeah, so the hospital has been using both Pfizer and Moderna. They both have, strict requirements to them. I think that either one of them are no better than the other. I think they're about the same. It's just a different manufacturer, and really, I think the difference is the way they're being stored and how many doses you can get out of the vial. So there really is no difference between either one. We have managed both of them, and we see no difference between either vaccine.
Okay. And Dr. Nickerson, do you want to add anything further to that first question?
Sure. If you have questions about your eligibility for vaccination right now, you can go to the State of Massachusetts website, and they have a questionnaire that you can fill out, and you click through yes or no questions, and it will tell you if you are within the eligible groups for these current phases. It also has more information to help you determine which phase you're eligible in, or which phase you're eligible in. And then in terms of vaccine, across the board with the vaccines that have been approved for emergency use by FDA, we are seeing protection against severe COVID disease. So getting a vaccine is a net win for everybody.
Thank you. All right, to all our panelists, we'll try to slow down speaking so the interpretation can stay with us. So the next question, and I think we'll be answering this frequently this evening, and it's worth doing that, is how can a senior get help to sign up for the vaccine? Mr. Webb? You're on mute, Mr. Webb.
Sorry. There's two ways, actually. One would be the call center that we've mentioned. The phone number for that, again, is 781-661-8500. The other way would be to call to the senior center and let the staff there know that you'd like to get registered. They will take your name and number and get it to us, and we will call you. The number at the senior center during business hours is 781-397-7144.
Okay. Our next question is, will there be translators for the phone line? Also, what about at the clinic? to help seniors when they arrive on site?
Yes, we will be having translators. Right now, we have, for the phone line, we've only been able to get Mandarin and Cantonese. So when you do call, there are operators available for those two languages. We are working with a community group that is checking to see if they have any other translators available that want to volunteer. If not, we'll probably make a phone call into Rosetta Stone and see what we can do there.
And what about at the clinic itself?
At the clinic, we'll have Chinese translator, a Vietnamese speaking nurse, and a Spanish speaking nurse.
Okay.
I'd like to add to that as well, Mr. Mayor. Also, if some folks call the hotline and if you don't get someone live, because what Chris was referring to were actual live volunteers that are taking calls. But if you get an English speaking volunteer and the language is indicated, we have the ability to third party conference in a language service line for just about any language possible.
All right. Our next question, this might be more for Mr. Lanphere. What type of vaccine, Pfizer or Moderna, is generally being used in cities and towns around us? So they mentioned Melrose, Medford, Everett.
So, I think it's kind of all over the place at the moment. I think there are enormous challenges outside of large tertiary care institutions and research organizations around cold storage freezers. So, if the vaccine is being used the same day, I think that, most places can use the Pfizer, but, I would suspect that many of the large vaccine programs are going to be using Moderna just because of the storage requirements are much easier than some of the others.
Okay, let me make sure that our interpreters are staying with us. Will senior housing residents receive the vaccine at their senior housing locations? Mr. Webb.
The plan is that as we speak, actually, the Housing Authority and other senior housing complexes are completing surveys, which they'll submit to the Department of Public Health. They will then reach out to me and we will determine the amount of vaccine needed at each building based on the survey that they'll be completing. Then what will be determined is which vaccine will be put into use and how much of a supply they give us. Once they give us the supply for each building, we will schedule a clinic with a private link. We'll give it to the management of that building and the residents will be able to register. That way we can go directly to the building and have a clinic for those occupants.
Okay, the next question, Mr. Webb, could you please give that phone number again for the appointment and when can residents start calling?
Great question. You can start calling Monday morning at 8 o'clock if you need us, okay? The number is 781-661-8500.
Okay. All right, the next question, do I have to wait until February 1st to see the 75 and over locations? Will the Salem Woods site be available for Medford individuals?
This time around for these clinics, that the answer to that would be no. These are Malden resident only. Medford will be having clinics very similar to this on the same days. We did that intentionally, so there would be no crossover, and that both of the larger communities in our region would be able to service their communities at the same time.
Mr. Lanphere and Dr. Nickerson, next question is for you. What is the difference between the two vaccines, and should seniors try to get one over the other? Dr. Nickerson?
The differences between the vaccines come down to some of the technical details about how they put the vaccines together. When I'll put a link in the chat that tells you a little bit more details about how vaccines work and specifically how these vaccines work if you want the technical details. But functionally, they work very similar to one another. And no, they're both effective at preventing severe COVID-related disease or COVID disease. So we should take the opportunity to get either one if we're eligible.
All right, Mr. Lanphere.
I would just say for the average consumer, the biggest difference between the two vaccines is that the Pfizer vaccine requires the second dose after 21 days, and the Moderna vaccine requires the second dose after 28 days. And it's important that people truly understand that it is best to get that dose exactly on the 21st day if you got Pfizer, or to get the second dose of Moderna on the 28 days. No health entity will mix any vaccine, so you should not have to worry that anyone will get one dose of Pfizer and a second dose of Moderna. You should get the same dose both times, but they do have different requirements for when the second shot is needed.
Okay. Next question is Roxanne Reddington Wild. Good evening. Do you have a sense of roughly when the senior housing sites will be able to offer vaccinations on site? Should seniors living in the senior housing wait until their own residences offer the vaccination on site, or go to the places on the dates being announced tonight? Mr. Webb.
I think that, if you can and you meet the eligibility requirements, you should go to the Salem Wood clinics. Don't wait, because here's the problem. Obviously, there is not a lot of vaccine. The availability at these two clinics is high. It's a lot of vaccine for, comparatively speaking. There aren't a lot of clinics that have this much vaccine. So we're excited that we're able to do this population. But if you can't make it, know that we will be working with each of your housing authority, building managers, and private senior housing management as well to get this done. I spoke to 4 different management companies today. We all got on the same sheet of music as far as the survey goes and how I would respond back with them and keep them informed.
All right, let's say hello to Brian. My parents are in their 70s and live in senior housing, and they may decide on taking the vaccine. However, I heard that the vaccines are undergoing changes due to new mutant strains. Should they continue to wait it out? Mr. Webb.
I don't believe so, no. Any protection is better than none. And for most of these vaccines that don't take in some of these variants, there will be a booster shot. And if that's generally how vaccines work, if they can't blend it or manufacture it timely, they'll come out with a booster shot of some sort that will mitigate those variants.
All right, Mr. Lanphere, why not wait it out and see what happens with all these strains? You agree with Mr. Webb?
I agree with Mr. Webb. I think it's important that people get protected as soon as possible. The only way we're going to begin to resume our lives as normal is to get these vaccines into people's arms as quickly as possible. But with that, we still need to continue social distancing, and we need to continue the mask requirements until we can get enough people vaccinated to begin looking at how we can remove these.
All right. And finally, Dr. Nickerson, you agree?
Agree completely. Absolutely.
Okay. All right, let's go to Anonymous. Although I am aware that educators and staff at the Malden Public Schools are not eligible right now, will the city be planning clinics for staff when it does update? And is the city willing to reach out to Governor Baker and advocate for this group to be moved up? Mr. Webb.
The answer to everything is yes. We are going to have a clinic for teachers. That is a large population in this state. It is, I don't have the exact numbers, but it is a large group of people. For example, 75 and older, there are 400,000 people in the state of Massachusetts that are 75 or older. Teachers probably come very close to that, if not more. And that having been said, with the vaccine supply so low, they have to be able to build up a supply and distribute it. I really am hopeful that it will fall on the tail of the 65 and older, and kind of almost a blend. I'm really hoping that the vaccine is stockpiling as we speak.
Okay. Our next question is from an anonymous attendee. I am a senior citizen and taking heart medication. Should I check in with my doctor, or can I just sign up and get the vaccine? Mr. Webb?
You always want to check with your doctor before you take another unprescribed medication. It'll be just a quick call into the office. They'd be able to give you good information quickly. And there are questions on the form that I want people to understand. They will not exclude you from a vaccination. So be truthful, because it's important for the medical staff vaccinating you.
Okay, Mr. Lanphere or Dr. Nickerson, do you want to add? Mr. Lanphere?
I think that Chris said it very well.
Okay.
I would add, don't be afraid to call your doctor. That's what they're there for. They know your history, they know you, they're comfortable discussing your medical history with you and advising you if it is a good time for you to get the vaccine. So please use those resources.
Back to the questions to clarify. Do we go on the state website to register for the Malden clinics? Also, I missed what was said about the senior center. Mr. Webb.
You're on mute there, Chris.
Yes, you do have to go onto the state website to register for vaccination. And I wanted people to understand why. That process lets the state know what areas are vaccinating people and will need more vaccine before others. It's all a timing situation. So if you're vaccinating at a good clip and not stockpiling material, you're going to get more vaccine when it's available. It's a rating system. So we endeavor to do a lot of vaccinating as quickly as possible. Our clinics are set up with 12 vaccinators so that we can get 1,600 people done in 2 days. That is a pretty good, impressive number these days. The senior center is a great place to call. If you call the call center and you can't get through, or the wait is too long, but you want someone to call you back, you can leave a message on the call center line as well. But if you're more comfortable calling the senior center, you could call the staff there during business hours. They will take your information and they will send it out to my staff, who will then call you and register you. The number at the senior center is 781-397-7144.
Okay. Let's say hello to Zaida Ortiz. Are there any initiatives to manufacture more vaccines here? I know what it's mostly being manufactured abroad. Mr. Lanphere, why don't we go to you?
Well, I mean, I think people should know that the Moderna vaccine is actually being manufactured here in Massachusetts. So I think that is one good option. I can't speak to how the pharmaceutical industry is managing their manufacturing. I think they're trying to move as fast as they can. I think there are a lot of questions come down to, should the manufacturer be sending directly to the state and communities rather than sending it to the federal government and then moving it back out to state and local entities? I think that is up for a conversation that the federal government is sort of discussing at the moment.
Okay, Dr. Nickerson or Mr. Webb, do you want to add to that, or is that pretty much captured? Okay, let's go to Facebook. Can elderly without transportation get assistance driving to a vaccination clinic? Mr. Webb?
Yes, actually they can. Good news is that Mystic Valley Elder Services will be providing free transportation to residents over 60. And the number to call for that service is 781-324-7705. Let me say that number again. 781-324-7705 for a free ride from Mystic Valley Elder Services. Now, when the 65 and older sector is ready for vaccination, I have spoken today with the group Malden Neighbors Helping Neighbors, and they would like to coordinate a ride program as well for that population because it is going to be quite large. And let's be honest, it's probably going to rain or snow on one of the dates, and it would be good to know that those people are there to back us up and get people to clinic and move the vaccine. So we're going to coordinate that as we get closer. So when that's finished planning, we'll have another event like this, I hope, and we can explain it.
Mr. Mayor, if I might just quick, I just want to remind all those that we are, although we're looking in chat as well, we do ask that you keep all of your questions in the Q&A feature of Zoom. That way we don't miss any of your questions. And also to the links that are being referenced this evening. I know Dr. Nickerson posted one. I just posted the link to Mystic Valley Elder Services in chat in the webinar, but additionally, I'm also simultaneously posting those in the YouTube stream as well. So if this is after the fact and you're not watching the webinar live, you wouldn't have those links. But if you visit youtube.com/City of Malden and you watch the replay, you will see those links.
All right, very good. Our next question is, when you make the first appointment for the vaccine, will you also have your appointment for the second dose scheduled?
Well,
Webb?
it's a good question. We have scheduled some seniors for their second dose. We've only done about 65 people who have called the senior center already. We did that hopefully by being able to show that we have enough people to start the conversation about getting vaccine. But the reality is when you go onto the state site, you won't be able to do that. But those dates are not etched in stone yet because we do not have vaccine committed for that date yet. We will. I can't imagine the state would give us this amount of vaccine and not have a similar amount stockpiled for us to have the second dose. That has always been the program. So I just don't know when we'll get it. It's going to be within the timeframes. Don't worry about that. I just don't know what the exact date will be because we have a lot of coordination logistics to do with storage because it is ultra cold. So it's a boring story, but it takes a little more work to schedule a clinic because of that. That's all.
Our next question, can Malden provide daily information about the vaccination sites across the state where Malden residents can get vaccine now, including vaccine type? Mr. Webb?
I don't think so. That kind of information in most communities is held pretty close to the chest until it has to be posted on the state website. The state website is the only place you should be looking for a vaccination clinic. Any other resource probably can't be trusted. That site is well managed and it's constantly being reviewed. So if you're having any issues there, please call the call center. I'll give you the number again, 781-661-8500. And I want to remind people, if you call a mass vaccination site like Danvers or Topsfield or Springfield, I'm sorry, not call, but go on their link and you have problems with their forms, know that those are different than the ones we're using in the municipalities, okay? And we cannot answer those questions because we do not have access to that software.
Okay. Let me go up to Dr. Nickerson and Mr. Lanphere. So a story that recently popped up was someone getting the shot and then getting COVID. So can you clarify for people exactly what getting the vaccination means for them and for us? Dr. Nickerson, we'll start with you.
Sure. Getting the vaccine means your body is ready to fight the virus if and when you're exposed to it. So think of it as like your body's superpower. You're ready once that virus enters your system, that your body is armored and protected so that it can fight that virus immediately. So getting the vaccine doesn't mean that you won't get the virus. It means that your body can fight it if you do get the virus. And it means that it protects you against severe disease. So severe disease is what we're seeing people end up in the hospital for, or potentially having life-threatening illness. And in the preclinical or the clinical studies of these vaccines, we saw that the vaccines were effective at preventing that severe disease.
Okay, Mr. Lanphere?
Well, I think it's important to note, for the consumers, that it takes roughly between 10 to 14 days for your body to build immunity. You're going to get about a little over 50% after the first dose. And then you should be, getting after the second dose, it takes another 10 to 14 days to be fully immunized, about 94, 95% efficacy. I think the news media throws these numbers around quite a bit, which I think creates a lot of confusion amongst people. But I would tell the general public that, that it does take your body some time to build the antibodies against COVID, and to be patient and not rush out and feel that you're immune from this. That we still need to take all necessary measures that we've been taking, but you're one step closer to being able to fight this virus.
We're going to stay with you, Mr. Lanphere, because the next question is around when someone does get vaccinated, why must they continue to still wear a mask?
So there's still several things. One, we're still learning more about with this disease. First is, again, as I talked about, you need 2 weeks between each dose to be fully immunized, especially after the second dose. But what we're also looking at, and we're still trying to determine, is if I got the virus, my body may be able to fight it off, and I will not get severe disease. However, what we don't know is, do I run the risk of being able to infect others? So by still wearing the mask, we dramatically reduce that risk. And until we get herd immunity, where a majority of the population is protected, we still need to keep many of these public health measures in place.
All right, I can't leave this question without talking with Dr. Nickerson, because she is very passionate about once you get the shot, that's not the end of it, right, Dr. Nickerson?
Right. Just like Christian just said, it takes your body time in order to mount that protection. So that 2-week window, your body's still learning how to fight COVID. So you need to continue to wear your mask. You need to continue to social distance, wash your hands, and use the protection strategies that we have until everybody is eligible to get their vaccines and have effective immunity against the virus.
Okay. Next question to Mr. Webb. So I schedule an appointment in 3 weeks, and leading up to it, I develop symptoms. Do I still get the shot as scheduled, or am I rescheduling? You're on mute, Mr. Webb.
First, you want to talk to your doctor and ask him. They will tell you in these times what your availability for COVID is. More than likely, no. That would probably be their advice. But the guidance is as long as you're 4 days without symptoms, you can be vaccinated.
Okay. Mr. Lanphere, I feel a bit achy, tired, etc. from getting the vaccine shot. Is that okay?
You know what? I think that means that your body is building immunity and your body is responding. I take that as a good thing. Be patient. I think I've seen, we've handed out about 8,000 or 9,000 shots. The most common complaint is the sore arm, but we have had people who have had flu-like symptoms Many of them resolve within 24 to 48 hours.
Okay, Dr. Nickerson?
That is also what I have heard, but I have also heard that there are people that do not have any symptoms as well. So no matter what, don't worry. The vaccine is doing what it's supposed to do.
Okay, Mr. Webb, you want to add anything?
No, just be prepared that you may have a reaction. Don't panic. It's like Mr. Lanphere said, nothing's gone past 48 hours that we've heard of. So just know that that's a good thing. May not feel that way, but it is a good thing.
I would
All right, go ahead, Mr. Lanphere.
I would just add one more thing. What we've noticed is that we've noticed more people, about 15%. So it's not a lot of people, but 15% of the population that we have vaccinated have had more symptoms on the second dose, and less so on the first dose. So it's important that people recognize that there may be a difference. You may not feel it the first time, and you might get something the second time, and that's okay.
Okay. Let's go to Kittbridge. I had heard that workers and volunteers in the warming center, shelters, and food pantries may be eligible in earlier phases. Is this so? Mr. Webb?
It is true. I am working with a department within the Department of Public Health to get enrolled in a program to provide vaccine for those locations. I have not gotten a call back yet, but I'm sure I will. She's been, I forget her name. She's a wonderful lady. She's trying very hard to catch up with me. We just keep missing each other. I plan on calling her first thing in the morning, and we're going to work out a vaccine program for those sectors.
All right, very good. Let's see. Mr. Cochran, do you have any questions on your end?
Yeah, actually, there was one that we had above that we got by. This was from Facebook. And also, too, I do want to remind folks that I've pasted a few more things in the chat, including this video, as well as a series of other videos that Mr. Webb has done in his department on the vaccine is available on our YouTube channel. So you can kind of review them chronologically. They kind of starts with the first update that Chris did, along with a nice little tutorial of the state's website, as well as the form that you would have to fill out. So if you kind of want to get adventurous and you want to try to fill out that form on your own, Chris's department has put a nice tutorial up on the website, on the YouTube account. So again, that's youtube.com/City of Malden, and that series is there. And again, that's link is in the chat. Question that we took from Facebook earlier was I'm trying to assist some neighbors and family members over 75, all but one in Malden, the other is in Medford. Question, do I have to wait until at the time, he says February 1st, but I think he means the start of it, to see those locations available to the City of Malden, or how do they pop up? I guess that's the essence of his question. If I don't see them one day, why do I see them another day?
Okay.
Mr. Webb?
Well, we're going to post our clinics Monday morning. First thing. Medford will also be posting theirs Monday morning. Melrose will also be posting, as well as Stoneham. So there will be area clinics coming up, and they'll all be available to peruse on Monday. But Medford and Stoneham may allow other outside people from other communities, but they'll probably be phase 1 people or public safety. The majority of the vaccine is dedicated in all of these clinics to people 75 years and older.
All right, we had another question come in. Can you take the vaccine if you are pregnant or are breastfeeding? Mr. Webb.
The guidance is to have these people talk to their doctors. And if I wouldn't be comfortable vaccinating anyone that's pregnant or breastfeeding if they hadn't spoken to their doctor and the doctor didn't tell them to get vaccinated.
All right, Mr. Lanphere and Dr. Nickerson, let's stay with that. Do you know of people who cannot take the vaccine whatsoever?
So I think going back to this question, this is a question we get a lot. And even within our own workforce, we have a number of women of childbearing age who have had a lot of questions about this. And, the World Health Organization actually out this past week actually came out against it. But the CDC and ACOG, which is the American College of Obstetricians and Gynecologists, did come out in support. But Chris has the absolute right answer. This should be a shared decision between you and your obstetrician. And it's something that you need to have a conversation with them about. We haven't found any group yet that we have said you should not get the vaccine. We have referred people with severe allergies to an allergist for consultation, especially after having a strong reaction after maybe the first dose of the vaccine. So far, the occupational medicine docs, as well as other allergists, have given the green light to at least staff that we're working with to go ahead and get the second shot, even though they may have had a severe allergy. But we have not found yet one group yet where there's a recommendation not to get it. But to go back to special interest groups, such as pregnant women, should be a shared decision. But also keeping in mind that we cannot vaccinate under 16 for Pfizer, 18 for Moderna. There are ongoing clinical trials now going on in those age groups, but no one, at least under the age of 16 at this moment, are recommendations out there to vaccinate children.
All right, Dr. Nickerson.
Agreed. This is a conversation to have with your doctor, especially. But importantly, there's more and more data being generated every day as our colleagues, as everybody starts to, as they are eligible, get the vaccine, and we get more information about how it protects these different groups. So if you have any questions or concerns about you personally, and how whether or not you should get the vaccine, that's what your doctor is there for. They want to help you make these decisions. So please reach out to them.
All right, doctor, we're going to stay with you, okay? As different groups get vaccinated, when does the impact of the pandemic begin to lessen in a way that everyone begins to reap the benefits?
From what I understand, we're already starting to see a benefit from the vaccine being out there. And that's huge. We're protecting our frontline workers, those who are being exposed to the virus daily, and we're only going to see those benefits continue to amass, especially when you have questions about risky populations such as expecting women or people that might be more vulnerable, that might not want to be right out there getting the vaccine right now. We're going to start to see them be protected as we mount that herd immunity. So I'll put another link in the chat about how vaccines work, and it has a nice little description of what herd immunity is and how we can all do our part in contributing to protecting those vulnerable populations.
All right, Mr. Lanphere, where you work at Cambridge Health Alliance, is it true that one of the benefits we're already seeing is fewer hospitalizations?
We have. So we have started to see the numbers have come down, which has really given our staff a little bit of a break from the virus. However, we also know that many of the spikes that we saw in the healthcare system were directly related to Thanksgiving and Christmas. And so we're asking people, especially this weekend with Super Bowl weekend coming up, to please adhere to the social distancing and minimize the parties. We need a break at this moment to keep our bed capacity at a rate that is people who need beds can get one. But I do worry that if people do start to party this weekend for Super Bowl, that we may be back. Our numbers may go up in the next couple of weeks.
All right. Over to you, Mr. Webb. The next question is, eventually, will this be an annual vaccine like the flu? Or is it a one-time kind of schedule? Or do we not know what the future holds?
I think it will be an annual vaccination until, and the reason that is, it won't probably be for like influenza every year, because the influenza shots are actually mixed viruses, all influenza, but they can give you up to 3 different vaccinations in one shot for different strains. I think as we're seeing strains develop now with the COVID, we're going to have, we'll call them booster shots, but laymen will call them COVID shots. And I think that's what will happen until the disease is actually eradicated. It's the only way. There are people there'll be stragglers in every country or pockets of people that don't get vaccinated for some period of time. Eventually, they'll build up an immunity, hopefully. But if they don't, then, the rest of us still have to get a booster so they don't make you ill.
Okay, let's stay with you, Mr. Webb. Our next question is from James. Other states undergoing vaccinations have seen disparity in who actually gets the vaccines. Will Malden maintain a public vaccination dashboard with racial, gender, age, and other breakdowns of vaccinations relative to the composition of our community? If not, why not? So we'll go to you, Mr. Webb, and then over to Dr. Nickerson. And then I'd be curious to hear from Mr. Lanphere if he's seeing anything like that in the hospital network. So, Mr. Webb?
I think that's something we could easily do. The PrepMod software has reports that it generates. Keep in mind, you're not going to get all of the information you want because they are personal medical records, but it does break it down by age, sex, race. So all these things are easily done. We can probably make nice pie charts like we do for our weekly updates. I'll look into that first thing tomorrow morning.
Okay, and Dr. Nickerson, as chairperson of the Board of Health.
I agree. I'm hoping that we'll see that data. Vaccine equity is really quite important. I also think it's also important to consider that the numbers we've seen in the media may not also reflect the workforce that's eligible for the vaccine right now too. We need to consider that who is out, what the breakdown is of our frontline responders, but the ultimate goal is to get the vaccine to everybody. And you heard Chris, the amount of doses that are being made available. We show up, we continue to show the state that we're getting the vaccine to our people, and we will get it to our people.
Okay. And Mr. Lanphere, are you seeing this across the hospital network of tracking this kind of data?
Yeah, we've definitely been seeing it. And we've seen a number of people, coming from a wide variety of networks trying to get vaccinated. But it's also important that we're also seeing some reluctance among some groups to getting vaccinated for fear of, distrust of the medical profession as a whole. But it's important that people get vaccinated.
Okay. All right. I don't see any other questions. Do you?
Yeah, not at the moment, but I thought this would be a good opportunity. We've got about 5 minutes left in the broadcast anyway, but I would think it bears repeating a few pieces of important information that were said throughout the night. I think the first would be if you have any questions in general about your eligibility. It's pretty obvious. The 75 and older one, not much room for interpretation there. However, if you're wondering where you fall on the next phase, you simply visit mass.gov/vaccine. That's one of the short URLs. There's many different ones, but that's the one that I've been using. And then if you are ready to go and you know that you're eligible for the vaccine and you're comfortable filling out this form on your own, you go to Mass Immunizations. Is it plural, Chris? massimmunizations.org, correct? Yeah. And of course, cityofmalden.org/COVID-19 for all the Malden related things. But as Chris has told me before, think of the vaccine as not a Malden vaccine, but it is a state vaccine that happens to arrive in Malden sometimes. So, start at the state level. And of course, the number that's been mentioned is the COVID vaccine hotline that the Malden Board of Health is staffing. Again, this will be open as of Monday. Right now, if you were to leave a voicemail, we would still check it. But if you're looking for live folks, that's starting Monday morning at 8 a.m. The phone number for that is 661-8500. I hope I said that right. That was completely from memory. Okay, I got that. Okay. And to you, Mr. Mayor, to close it out.
We just want to say thank you to everyone. And before we do close out, I think it's worth doing what we always do, which is to have our panelists say a few parting words and also provide their contact information in case someone attending here tonight has a question that they weren't able to ask or they think of it after the event is over. So we'll start with you, Mr. Webb.
Thank you, everybody, for watching tonight. I really do appreciate the feedback we get from these events. It does help us plan. It does help keep us going. We have been working on this for a year in the health department, and we are endeavoring to do our very level best. I promise you that. If you want to reach me, I can be reached by email at cwebb, W-E-B-B, @cityofmalden.org. My office number is 781-397-7049.
Thank you. Dr. Nickerson.
Hello, thank you for participating tonight or watching the videos, asking questions and staying informed. I cannot believe that a year ago we were only learning about this virus, and here we are today discussing how to get our population vaccinated. This is a remarkable feat, a journey that we have all been through together, and I commend you all for your part in wearing your mask, staying socially distant, washing your hands, and doing what you can. Days are getting longer, and there are vaccines on the horizon, so keep your hope alive. We're getting there.
All right, thank you. And finally, Mr. Lanphere.
Well, I just want to thank all of you, and I want to thank our interpreters tonight for reaching out to the very groups we need. We need you to get vaccinated, and we need to communicate and do better to make sure that all of you get all the information you need to make an informed decision, because we're counting on you in the healthcare profession to make sure that you're protected just like everyone else. So thank you. My name is Christian, and I'm with the Cambridge Health Alliance, and we can be reached at 617-665-1000.
Okay, and we would typically in there, but Mr. Webb, I see in the chat, it's probably worth mentioning again, the 2 clinics, the dates, the times, the phone number, and the location of where those clinics will be held.
Absolutely. The first clinic will be Wednesday, February 17th, from 9 a.m. to 5 p.m. at the Salem Woods School. The second clinic will be February 20th. It's a Saturday, from 9 to 5 p.m. The vaccine we'll be using is Pfizer. If you have any questions about that, please call the office at 781-397-7049.
Okay, and Mr. Lanphere, they asked for your phone number one more time. If you could say a little bit slower.
Sure. 617-665-1000.
All right, very good. So on behalf of Mr. Cochran, our communications director, Uma, and Rosetta Languages, we just want to say thank you for participating this evening. Thank you for your patience. And if you want to know that we are slowly getting to where we want to go, today we welcome back our pre-K to 2nd grade students. And if you were there, you would have seen that it's worth the wait. So hang in there just a little bit longer, stay with us. And as they say in Arabic, ma salama. We'll see you again soon.